Welcome back. This is Corey Minter, and we'll be talking about Chapter 2. First, you notice with Chapter 1's lecture, it was fairly short. It was only 14 minutes or so. I plan on trying to keep these as short as possible, and I just want to focus on the main points of the chapter. I do expect you to read the whole chapter and take notes, but I just want to touch on the main points and get some information across. So let's get going. Chapter 2 is a healthcare organization and administration in athletic training. Extremely important part of our job and very, very time consuming. So it's best to stay really organized. So let's go through and start off with the system of healthcare management. First to note is a strategic plan development. Okay, you need to determine why there is a need for such a program. Okay, the second one is goals. So determine function of program and what the goals should be. Okay. Decisions of administrators will determine extent of healthcare program and athletic training. You need to develop a written mission statement to focus on direction of the program. Strategic plan development must include a wide variety of people, such as the administrators, other allied healthcare providers, student athletes, the coaches, physicians, athletic trainers, the parents, and any community health leaders. Okay. Next is your SWOT analysis, the SWOT. It's the ongoing process that reviews your strengths, your weaknesses, your opportunities, and your threats. Okay, this is how you evolve and develop into an even stronger strategic plan. You must routinely examine a cost effectiveness of operating healthcare programs to determine the value of the return of their investment. Okay, creation of policies and procedures for all involved in the healthcare. This is something that, as you go through the program, wherever you may end up and then start your career, definitely start paying attention to other people's policies and procedures and get ready to create your own. Policies are clear, written out statements of basic rules, the critical element for operation of an athletic training clinic. Procedures describes the process. So let's talk about providing coverage. So for the facility personal coverage, operate coverage of facility and sports. The setup of treatments, rehabilitation, game, and practice coverages may vary. Second one is the sports coverage. A certified athletic trainer should attend all practices and games. Okay, different institutions have different levels of coverage based on how many people they have employed with them, so based on their personnel, and the risks involved in the sport. So if you're short-staffed, you can pick maybe not to send somebody out to tennis because basketball is a contact sport. So you need to have somebody there at basketball. It's making those types of decisions. They're also reachable via the phone, so they can still come to an aid in case something did happen. So this is a really good one, and this is one that we can help with a lot of different infections. So let's talk about hygiene and sanitation. Okay, in the athletic training clinic, there's rules concerning room cleanliness and sanitation, and these must be set and made known to the population using the facility. The operation should abide by policies set forth by OSHA. Okay, examples of that would be no equipment or cleats in the athletic training room. That helps keep the athletic training room sanitary. Okay, shoes off the treatment tables. Not only does that prevent the spread of bacteria and stuff from you walking on the ground, but it also saves the cover of your treatment table. Say you just got them nicely recovered, shoes go on there, they can rip. So that works on both ways. Second, or the third one, cleanliness, which is shower prior to treatment. There's no rough housing or profanity. All these are really good rules, and I know most high schools have them posted. Probably saw that in your high school. Um, and then there's no food or smokeless tobacco. Okay, cleaning responsibilities, cleanliness, should be addressed appropriately by the athletic training staff and the custodial staff. We need to know who's doing what for cleaning and stay on track on that. Maybe have a schedule set forth. Okay. The maintenance crew. You need to know who sweeps the floors daily, who cleans them, disinfects the sinks and tubs, the mop. They need to mop the hydrotherapy room because people walk around barefoot usually. They need to empty the wastebasket, so you need to find out, is it your custodial staff that comes in and does that, or is part of that the athletic training staff? So that needs to be determined. So concerning the athletic training staff, definitely need to make sure those tables are clean after each athlete, ideally. You need to disinfect the hydrotherapy modalities daily. Most PT clinics disinfect the hydrotherapy after each patient. Usually with us, as long as they don't have any open abrasions, we have disinfectant in the water, so cleaning them daily is sufficient. And definitely need to clean the equipment regularly. Anything that's used, rehab equipment, you need to spray off, disinfect daily. Last thing on there is the sporting facilities and equipment. Sometimes the athletic trainer has to be responsible for some of that, but it is an important duty to find out and to make sure that's done. Like gymnasiums or wrestling rooms, cleaning the mats, sweeping the gymnasium floors, cleaning and sanitizing drinking fountains, the showers, locker rooms. And for the equipment, first off, not only is it important that they fit properly, and that's one of our responsibilities to make sure, because if we see something not fitting properly, we need to make it known to the equipment coordinator or the coach. They need to make sure that they're frequently cleaning their clothes, their practice clothes, their game clothes, and cleaning any of the common equipment that's used. Make sure there's appropriate equipment for certain weather conditions, and they need to use towels, clean towels, and to make sure everything's nice and dry so mold and bacteria doesn't grow. Let's talk about the athlete. An athletic trainer needs to help the athlete out, help promote good health and hygiene. Okay, it's a critical part of an athlete's life. It'll make the athletic trainer's job easier as well. Don't have to worry about as many skin infections or the spread of any kind of infections. Okay, so you need you need to let them know that they're injured or ill. They need to report promptly. Okay, they need to follow good living habits. They need to shower after practice. They need to avoid sharing any clothes or towels or razors. They need to exhibit good hygiene practices. They need to avoid common drinking sources, like drinking fountains and stuff like that. You'll start to notice that if one of the athletes gets sick, gets a cold, then it starts spreading pretty fast. So it's good to implement these practices right in the beginning. Okay, you need to avoid contact with any other athletes that are contagious. Maybe they have a contagious disease, they're sick, or they have a certain infection, to avoid contact with them. And they need to understand that the role of what exercise can play into to maintain a healthy life. Let's talk about emergency telephones. Always need to have accessibility to a telephone. Always. Most time nowadays we have cell phones, so always make sure you have cell phone service and that your battery is charged. Okay, so you need to you need to be able to contact outside emergency help and be able to call for additional athletic training assistance. Sometimes you can provide radios, like at practice, like at football practice, especially when all your help is spread so far. Give them radios. You can use the cell phones, and all those help to aid in that communication, especially when an emergency arises. Let's talk about budgets. This is an important aspect that a lot of high school athletic trainers have to go through, but college as well. Everyone has a budget. You need to be able to operate within that budget. So what's the first concern is the size of your budget. You need to find out what that is. Different settings cause for different sizes and different needs, and there's different space allocations as well. Equipment needs, you need to find out if you need any new equipment or supplies, and that varies as well depending on your setting, college versus high schools. You need continuous planning and prioritizing to effectively manage your allocations and meet your goals. Supplies. First, you need to find out your expendable supplies, which involve supplies that cannot be reused, such as first aid, injury prevention supplies. Okay, ankle braces, those should not be reused. That should be given to the athlete. Band-aids, gauze, peroxide, alcohol, ointments, anything like that, stuff that cannot be reused. Those are called expendable supplies. And then you have your non-expendable supplies. Those are reusable supplies, such as ACE wraps, because once you give out an ACE wrap, you have it laundered, so it becomes clean again. Scissors you reuse. There's multiple items, sharks, multiple items that you can reuse. Those are called non-expendable items. Okay. You need to have yearly inventory and records that need to be maintained in both areas for your expendables and non-expendables. In the larger settings, the inventory is done, sometimes it's done weekly, most times it's done every 2 weeks, and some are done once a month. And those are the big, like D1, D2, some JCs do that if they have like 21 sports or such. Now let's talk about equipment. Okay, items that can be used for a number of years. That's equipment. Capital remains in the athletic training facility, which includes like ice machines, the treatment tables. Those are all capital. Those remain in that facility. Non-consumable capital is stuff like crutches, coolers, athletic training kits. Those will tend to be replaced more frequently, depending on how rough you are on your coolers. A lot of times the nozzles break, so you can replace the nozzles, but if there gets a crack in the actual cooler itself, it's no longer good. Crutches you lend out, but sometimes you don't get that back, so it's important to make a checkout list so you know what athlete has what. Okay, keep an eye on that stuff. Costs start adding up. And the athletic training kits, most time if you're good to them, they last a number of years. Okay, those are called non-consumable capital. Okay, let's go to the next one. Let's go purchasing systems. You have direct buy versus competitive bidding. And then you also have a lease alternative. There's different types, okay? Some additional budget considerations. So additional budget considerations. You have telephone. You could possibly have telephone expenses, postage expenses, utilities, contracts for outside services, purchases relative to liability insurance and professional development, such as your CEUs. So that needs to be taken into consideration as well. Do those things come out of your budget or the athletic training department's budget? or the athletics department budget. You need to find out where that comes from, okay? Next, we're going to do developing a risk management plan. Risk management plan is exactly what it is. You're finding out what the highest risks are, and you're trying to come up with a plan to reduce those risks. And we'll go through this fairly briefly. So we have security issues, which is like the accessibility to the athletic training clinic. Who's able to go in there, like the staff, the physicians, the athletic training students. Athletic training students must be supervised when in a clinical setting at all times. Okay, an athletic training student cannot be left alone in a clinic by themselves. They need to be supervised. Coaches may have access in some secondary school settings. Okay, so that all has to do with security issues. Then you have your fire safety. You need to post evacuation plans in case of a fire, so make sure you have that posted in your athletic training facility. You need to make sure all your smoke detectors and alarm systems and fire extinguishers are appropriately tested and in place. Electrical and equipment safety. If there's any major concerns, be aware of power distribution systems to avoid any accidents. Okay, and then you need to have an emergency action plan. And I know at Fresno State, we have EAP for every facility and for practices versus games. So make sure you have emergency action plans. You need to be able to access emergency personnel outside setting in the event of an emergency, include transportation of the athletes to emergency facilities. Meeting with outside personnel is necessary to determine roles and rules regarding the athlete and equipment care. So meeting with your ambulance company, whichever one you guys use. Now let's talk about the athletic training facility design. Okay. So I know in your book there's a picture of a facility and stuff, so really pay attention to how that's laid out and what the best function is. And that way when you visit different athletic training rooms, start paying attention to that, see how well that works. Okay, because if you ever get your own athletic training facility, you might have a better idea how to rearrange it so it functions better. Okay. So designs will vary drastically based on the number of athletes, the teams, the various needs of the program. There is the different size, which varies. You may take advantage and manage space effectively. You learn that you'll run out of room really quickly. Interact with any architects relative to the needs of the program and athletes if you're building a new facility. Locations. Outside entrance, you need to limit doors that must be accessed when transporting injured athletes. Double door entrances and ramps are ideal. Proximity to locker rooms and toilet facilities. Light, heat, and water source should be independent from the rest of the facility. Illumination, well lighted throughout. You need to be able to make sure you can see your athlete. Reflective ceilings and walls will aid in that process. Natural lighting is a plus. Special service areas, stuff is like your treatment area, your electrotherapy area, your hydrotherapy area, your exercise rehab area, your first aid station, like your taping and bandaging and that. And then your physical exam rooms. Hopefully you have ones where you're going to have at least one room that's private so the physician can come in and examine the athlete. And then you need to have your records area because that needs to be behind locked doors. Okay, and then you have your storage facilities. They often lack ample storage space. So this is where storage gets creative. Storage is in the athletic training room that holds general supplies and special equipment, a large walk-in storage cabinet for bulk supplies, a refrigerator for equipment, ice cups, so it's important to have a freezer, and for any medicine that needs to be refrigerated or additional supplies. You should have a space for the athletes or the patients' personal stuff. Most high schools don't. We don't have enough room. The athletic trainer's office, ideal is like a 10 by 12 space. The equipment inside that room should include like a desk, a chair, tack board, a telephone, a computer, and it needs to have an independent locking system. Okay. And that office should be able to view every aspect of that athletic training room. Okay. They need to be able to see the hydrotherapy room, where there's water. They need to be able to see the rehab, treatment tables. Some of the additional areas at the bottom is possibly a pharmacy area, a separate room that can be secured for storing and administrating medications. This works in collegiate. Okay, those need to be behind locked doors, and strict records need to be maintained on those. Rehab pool, if you have that, that would be great. And if restrooms, if you can have restrooms in the facility, most time it's not, it's outside on the school premise or such, but sometimes you can have restrooms inside. Okay, so look at the diagram in the book, and that displays it pretty nicely of a nice big large open space and kind of how to structure stuff. We'll go over this more in class too. Okay, so potential athletic training duties. Let's go. So the things that can be part of your duty, let's go over the first one. It's the ergonomic assessment. It's the science of designing products, machines, and systems to maximize comfort, efficiency, and safety. You might get hired on to assess the ergonomics of work areas. So that way if they notice that sitting at a desk hurts their back, you can readjust the tables, maybe raise the computers, adjust the chairs. So that way it takes away the back injuries. That's what that's dealing with. Then you have the work hardening and conditioning programs. Those are intensive outpatient therapies for individuals injured on a job. Work conditioning is typically treatment 3 hours a day, 3 days a week. Work hardening is 8 hours of treatment daily, 5 days a week. The goal is to restore functionality and return them to full duty capacity. Okay, then you have the evaluations. We'll go over more about evals, but you deal with the musculoskeletal examinations like such as strength, posture, flexibility, gait. We'll go over all that a little bit more in depth throughout the semester. Okay, and then you have wellness center. You could possibly be working at a wellness center. Athletic trainers may be involved in organizing wellness screenings and workshops, such as talking about health, cholesterol, hypertension, asthma, and items like that. You might hold health fairs. Okay. Community outreach and marketing. Some athletic trainers may be clinic or hospital or work in hospitals, and they need to provide athletic training coverage. Okay. Outreach may occur in the collegiate setting, secondary schools, or for single athletic events. There's a lot of different possibilities. Corporate fitness programs involves in-house fitness programming for employees, provides numerous health-related benefits to the employees, also serves to reduce the health costs and help increase productivity, reduce or improve morale, lower the healthcare expenditures, and reduce sick leave. So that saves companies lots of money. Drug testing programs might have to be part of that. Athletic trainers may be asked to oversee a drug testing program. Program may act as a deterrent to employees coming in unfit for duty. I know there's drug testing programs for the athletes, especially at Fresno State, and I know we're somewhat involved in on that. Let's see. And next is fiscal management. Having a basic understanding of business practices may be necessary in for-profit clinical settings. You need to have knowledge of billing practices, maintain positive accounts payable versus accounts receivable ratio is the goal of all successful businesses. Okay. So we'll go over record keeping. We'll discuss that a lot, of always being appropriately keeping your records. That's one of our major responsibilities. We need to make sure all records are accurate and up to date. It's hard once you start falling behind, so stay up with it. Okay, such as you have your medical records, your injury reports, insurance information, injury evals, progress notes, equipment inventories, annual reports. Okay, next is maintaining confidentiality in record keeping. So we have the release of medical records. It is a written consent, and that is required before we release any medical records. Okay, waiver must be signed for any release, and this includes specifics of the information to be released and to whom. Okay, and then that release is kept on file as well. Then you have the Health Insurance Portability and Accountability Act, HIPAA. It regulates, like we talked before, so it regulates dissemination of personal history information by coaches, athletic trainers, physicians, or other members of the sports medicine team. Guarantees the athlete access to information and control over disclosure. Athlete may provide written authorization for release of information. Okay, so now we have the HIPAA authorization. So description of information is to be disclosed. Identification of the parties authorized is provided to make use of the PHI, what we talked about earlier. Description of each purpose of the use or disclosure, expiration date or event, individual's signature, and the description of his or her authority to act for the individual if signed by personal representative. So such as, I need the x-rays of the right ankle to see if there was a fracture, and then list your name. The athlete signs it, gives permission, and then it's faxed over to receive that information, to receive that x-ray. All right, now Family Educational Rights and Privacy Act. It's called FERPA. It's a law protecting privacy of students' educational records. So like HIPAA is for the medical, FERPA is for your education records. So same basic things. Once a child turns 18, the rights are transferred to the student rather than having the parents have the rights. The school must have written permission prior to releasing any information. Okay, so now we have the pre-participation examinations. Your initial PPE is prior to the start of practice. Okay, this is very critical, so that way you know the risk before they go out there. Purpose is to identify the risk of the athlete. It should include a medical history, a physical exam, orthopedic screening, and a wellness screening. It establishes a baseline, so it tells you where they were at when they came in, and it satisfies the insurance and liability issue. Examinations by the personal physician that usually yields an in-depth history, and it's ideal for the patient-physician relationship. it may not result in the detection of factors that predispose athletes to injury. Most time we do station exams. This provides athletes with a detailed exam in a little time. It's usually depending on how big your school is, depends on how many physicians you need, how many non-physicians, how many people to help manage the situation. I think we use 4 orthopedic physicians, 2 general med physicians, dentist, a lot of personnel to help. Probably have 15 to with the students. So wow, so probably around 15 to 20, if not more, students helping to run through our athletes. And this is usually everybody in one night, and it's fast. And they see our team physicians, so the physicians get a chance to meet them. Okay. Then we have the medical history. It's a complete prior. It's to be completed prior to the exam to identify any past and existing medical conditions. And it's updated yearly, and it's closely reviewed by the medical personnel. You need to be able to collect the medical release and insurance info at that same time. Okay. The physical exam assessment should include height, weight, body comp, blood pressure, pulse, vision, skin, dental, ear, nose, throat, heart, lungs, abdomen, lymphatic. For the younger ones, let's see. Some do urinalysis. Some do blood work. Let's discuss the maturity assessment. And what this is for is to protect the young, physically active athletes. Okay, the methods. Now, there's 3 different methods there to collect the maturity. Let's see. Let's talk about the Tanner's 5-stage assessment, which is the most expedient. And then we review. It's a 5-stage assessment, and then I know go over that in your book. We'll go over that in class. And then we have our orthopedic screening. It's part of the physical exam, or it can be separate. We do it all at once. It's station to station. It's a various degree of detail concerning the exam, so based on the athlete. Let's go over sport disqualification. And this is to be found at the PPE. Okay. One thing I did want to mention was the sickle cell. Sorry, because you have your wellness screening, but the sickle cell trait, we do that at the D1 level, and that's required. And that's a blood test to see if they have the sickle cell trait. So that way we can keep a better eye on them when they work out. But sport disqualification. There are certain injuries and illnesses that warrant special concern. Recommendations from the physicians can be made, but because of the American with Disabilities Act of 1990, that dictates that the athlete makes the final decision. Any potential disqualifying factors, like I said, should be determined during the PPE. So personal injury or personal information card and injury reports. So the PIC, personal information card, should contain information for the family, the personal physician, and insurance information. The injury reports serve as future references. The reports can shed light on events that may be hazy following an incident. So it could let you know what was going on before that happened, and maybe that's why they got injured. so it can shed some light on that. There's definitely injury reports are necessary in case of litigation, in case you get sued. Okay, it's always good to document, and this is why, is to protect yourself. Okay, all reports should be filed in the athletic training facility. Treatment logs. Sometimes you have a sign-in to keep track of the services, so the athlete will come in, sign in, put down what they're doing, and that's done daily. You can definitely record the daily treatments. We usually have them write it down and we record it electronically, so we always have it on file. Treatment of daily therapies can be monitored along with compliance. Like, hey coach, they haven't been coming in, don't know what to tell you. Okay, or like, hey, yeah, they've been coming in every day treating for that. That's very helpful, and they can be used along with the injury logs for legal documentation in case you have a lawsuit filed against you. Like I said, always keep records, lots of records. And our last slide is the injury evaluation and progress notes. We'll go over this as well, more in class. Injuries in progress should always be monitored by the athletic trainer and recorded. Okay, we use a SOAP note format, and it's spelled out what they mean. So the S is for subjective, such as the history of the injury and illness. O is objective, information gathered during evaluation. A is assessment. It's the opinion of the injury based on the information gained during the evaluation. And P is plan. You have both your short and long-term goals of the rehab. And that helps you stay on track and keep focused. And then the progress notes are constantly maintained throughout your rehab, so you can make sure you're going along the right track. So we'll learn how to fill those out in class. All right, so that concludes the Chapter 2 lecture. And if you guys have any questions on any of this stuff, we'll talk about it in class. So make sure you read Chapter 2 and then take some notes.